Good evening, and thank you so much for joining us. Good evening. My name is the Reverend Dr. Arlesia Simmons. I'm the Eastern Regional Associate Director with Partners in Health and Wholeness, an initiative of the North Carolina Council of Churches. And so we are excited that you have joined us tonight for our Faith Health Connection, developing dementia-friendly African American communities of faith. And so before we begin tonight, I want to open with just a brief word of prayer. I'll share some information about some upcoming events with PHW, and then we'll begin tonight's program. We have two amazing guests, and we are excited that they're with us tonight. We're excited that you are joining us on this evening. So let us center our hearts and let us pray. Oh, gracious God, we thank you for this day that you have made. We thank you for your protection and your safety and how we are able to gather in this digital space on this evening. And so, God, as we would move forward in this program, we pray for the strength of our presenters who have worked and traveled. We thank you for our facilitator, Krista Westervelt, and how you've protected her this day. And we pray that the information we receive on tonight would be of benefit to our congregations, our communities, and to our families as we continue to minister, help, love, and care for those with dementia. It is in the name of Christ we pray. Amen. So again, I welcome you to tonight's program. And how we will begin is, this is your welcome. And we have one announcement. I will then allow Krista or introduce Krista, who will present or facilitate tonight's session. And so Partners in Health and Wholeness, some of you know us because of our grants that we are able to administer and we're able to give out so that you can continue to do the work that promotes health and wholeness in your communities. And so we are in the second cycle of the year. We invite you to visit our website at healthandwholeness.org, where you can learn about our many grants as well as our denomination-specific grants. And so we invite you to apply for a mini grant if you have already done a collaborative pledge. And if you go to our website, you will learn how PHW has evolved. There has been some changes, but how to become a collaborative partner with our organization. And so again, we welcome you. We thank you for being with us. And on this evening, your facilitator or moderator of this conversation will be Krista Westervelt, who is an associate director here with PHW, and her focus is healthy aging. And so, Krista, I turn the program over to you, and I thank all of you again for being with us.
Thank you so much, Arlesia. I so appreciate it. So just a little background on how today's programming came to be. For a number of you might be familiar with our recently released earlier this year Healthy Aging Inclusion Plan. And as I was putting that together, I was looking at ways that congregations could become more dementia-friendly and more inclusive of families experiencing a loved one who has dementia. And as I was doing that look at that inclusion plan and getting that created, I stumbled across the Altar program, and I was thrilled to find out that they exist and the amazing offerings that they have. And so tonight we have with us the founder of Altar, Dr. Epps is with us tonight, and then also the project director, Mia Chester. So thank you both for being here, and I will turn it over to you two. Thank you.
All right, thank you so much and good evening. We are just going to get our PowerPoint uploaded, but I will welcome Dr. Epps at this moment to share a little background about herself while I get that PowerPoint. Oh, Dr. Epps, you beat me to it.
Yeah, I made some changes, a couple of changes. So can you hear me okay?
Yes.
Yes.
So good evening, everyone. I am Dr. Fayron Epps, an associate professor of nursing at Emory University, and also the founder for the Altar program. So I'm so glad to be here. And as mentioned by Krista, I am accompanied with Mia Chester. She's our project director. And I'll just give you all a little bit background because it's not in our slides, but I've been in Atlanta for 7 years, but I've been doing work in the Black community promoting dementia awareness for, I want to say, a little bit over 10 years. I'm a nurse. I've been a nurse for over about 20 years, 23 years. I've been a nurse. And, one of the reasons why I started really promoting dementia awareness is because the literature that I was reading when I was going through my PhD studies said that communities of color were disproportionately impacted by dementia. And I didn't know that. And I was a whole nurse. And then realized really how my community was impacted. And then at that time, I just took it upon myself to start this mission to spread awareness. And as we'll go on, we'll talk about how the church came about. I'm gonna let you all know that first, it was just me going out and just educating whoever I can within the Black community. And then it kind of just evolved. Mia came on and it evolved into us now working with the churches. Mia, would you like to say anything about your background before we move on?
I'm going to stay silent. I have a little one in the background, so please forgive me. Yes.
All right. Well, we're gonna go with it. All right. And so when I started doing this program, when I eventually moved to Atlanta and 7 years ago, I was continuing the education. Mia was on my side with also some of my other colleagues, and a bishop came to us at one of our education, and he said, "Well, Dr. Epps, this is great, but what do I do with it? What do I do with this education? How do I apply it within my congregation? How do I help my deacons, my deaconess?" And I was just like, oh, because I always just thought, let me just give education. But, many times we don't think about, well, how are we going to make sure they apply it? What's the follow-up to that? And so that's when we went back to the team and we said, we need to create something, a full-fledged program that goes beyond education, that can really support our faith communities, our places of worship, to help them apply and better support their parishioners and the community at large that may be faced with dementia, but also brain health. We want to make sure that they support them. And this has really turned into my ministry. I would tell y'all that. I'm a woman of faith, and growing up in the church, even though I might have veered off a little bit, of course, but I knew where to come back when I needed help. And that's what many families, even though if they don't come to church frequently, especially in the Black family, if something goes wrong, one of the first things they do is call the church, right? And so this program is designed to give these communities, faith communities, the tools that they need to better support these families. As you heard before, we are created to respond to the disparities that are dementia-related disparities. And for those that are not sure what these are, African Americans are twice more likely to be diagnosed with Alzheimer's disease or a form of dementia in comparison to their white counterparts. Anyone with a Hispanic background is 1.5 times more likely. And a lot of that is due to the type of dementia that we receive. There's over 200, 300 types. There's several types of dementias. But in the African-American community, we tend to get vascular dementia, which is related to many of the cardiovascular disorders that exist in our community, such as hypertension, diabetes, strokes, TIAs, those kind of things. So I just want to make sure I connect the dots for you on why those disparities may exist. Even stress is a big thing, and the racial discrimination that many persons of color face every day has shown to cause cognitive decline over time. And so we are trying to respond to that. We also want to shift the perception in the Black community, in our churches, on dementia and those that are aging. We want to reduce that stigma, and we want to enhance empathy for these, enhance empathy so they can really understand what these families may be going through. So we recognize that places of worship, they're members of the care team. And so when we go to our churches, we say, you're just not on the sideline. You're part of this care team for your parishioners, for your families that are here. And it's so important to make sure that our families are still engaging in the church because it helps reduce isolation, which is a risk factor for depression, which is a risk factor for dementia. Right. And it also maintains spiritual connections for both the caregiver and that person living with dementia. So many times we put these programs out, but we just forget the spiritual component. And at Altar, we don't, because again, like I mentioned, I'm a woman of faith, my whole team, and we know how important that is for ourselves, our families, and those persons we work with. So how I do this, I have a team at Georgia State, I have a team at Emory, and I have a lot of volunteers for us to make this happen. And we'll talk more about that. How much time I have? Because as y'all can see, I can talk.
Oh, no, you're good. You're doing great.
Okay. All right. So,
yeah, you're good.
all right. So Mia will put the link to our website in the chat, but I just want to let you all know that this is a screenshot of our website. And, you know, we are really here to create dementia-friendly congregations. We want to inspire and equip our faith community. So we are always looking for partners. And when we say partners, we're looking for churches to partner with, but we're also looking at organizations that we can partner with to continue to help our churches. We provide a newsletter, and then of course, in order for us to keep doing our work, we ask for donations. But I just wanted to kind of put that out there. But within this website, you can learn more about our program. You can learn about the churches that we have. That's under the Altar resources. You'll see a map of all of our churches and the denominations that we currently work with. And if you don't see a denomination that we don't work with, and you want to connect us, we are down to connecting. All right. So how we do our program, a lot of it is built on trying to achieve health equity, right? And we recognizing the various components of social determinants of health and how we need to bring all of these resources together to help out these communities that we are working with. And we use a three-pronged approach. So we have support, education, and worship. So we want to make sure when we partner with our faith communities, we're working with them to put things in place so they can offer resources for care partners, caregivers, persons living with dementia. Also, education and awareness is another pillar. So we want to make sure that our faith communities are providing and promoting church and community education and awareness opportunities. And then our last pillar is worship. So we work with our faith leaders to consider what are those things that we can do to possibly modify some of our worship experiences or services, not all of them, but to make sure that what can we do so these families can still be able to engage in worship. Okay. Mia, just let me know if I have a chat. Questions or anything like that. So how do we do this? You're probably like, okay, how does this really work? So we do partnerships with our faith communities, and they're 2-year partnerships. That's what we start off with. And we say 2 years because we are asking our faith communities to implement 16 initiatives or activities. And it can take 2 years. It is okay, because our faith communities come to us at different readiness levels. Right. And we want to work with them over that 2-year period to implement this, to try it. And then after 2 years, they can come to us, we meet with them and we ask them, everything went well? Would you like to continue on as a legacy partner? Or this is just not what's working? And then that's fine. But we always ask them, at least. We provide a welcome box to our faith communities that sign up. I have internet connections unstable. So we have a welcome box and it's almost like a, what you call it, Mia, a jump start. Like we giving a jump start to our faith communities. Mm-hmm. Because within the jump start, we provide pamphlets, booklets, guidebooks, literature, just things that you can start having as a resource to your parishioners. We have a memorandum of understanding. Again, that is making sure that we have a clear understanding over this 2-year partnership, what's going to be expected from us at Altar and also from you. We provide financial contributions to our churches. So right now we're able to provide $1,000 contribution. And this is so At first we was hearing faith community say, oh, well, we already did our budget for this year. We have the next year. And so this was our way of, if this is something you see that you really want to be part of, you see a need within your community or within your congregation, you don't have to wait. We want to be able to gift you with these funds so you can start doing some things. And then we will work with you to apply for other grants. I partner with a lot of people where we create scholarship opportunities for our faith communities. Thus far, we signed our first church in 2020. So for the last 3 years, we have invested a little over $80,000 into our faith communities. Back into our faith communities to make sure they have what they need. The 16 initiatives, and we'll give you examples of what they look like. And then I talked about what the legacy partners would be after the 2 years. So currently right now in this 3-year period, I just want to let you all know, you'll see this map on your left-hand side. We have partnered with 59 faith communities. And we're in 13 states and also DC as well. And we're moving over this map. We got to update our map because now we have someone in Texas, we have someone in California now, but we're also trying to move more to Southwest and West Coast. Our vision is to have these blue dots all over. And we've also started partnerships in Ghana as well with the AME Zion Church for their West Africa, I should say. So just to let y'all know that, we are really trying, just because we're based in Georgia, we are really trying to make sure we have this reach all over, because families do contact us and they're going to want to know, well, what's one of the churches you work with? And we want to make sure that they have these resources. So some examples of the initiatives, remember our first pillar was support. And so we encourage our faith communities, they select 2 to 3 items, and some of them want to do a memory cafe. And this is a place, I say, this is a safe place for families that are on this journey where they can come and hang out. So they're not coming to worship, but it's a place that they can engage with others. You can even invite the youth to be part of this. Do art, you create the agenda. But again, it's just a safe place that they can come. Support groups. We have some of our faith communities create a support group, or they may connect to another support group that exists, and that's perfectly fine. The whole purpose is if a family comes to you and say, I need help, you know where to send them. Creating a resource library during respite programs. We have some of our faith communities that do full-fledged respite, like an adult day. Then we have some of our faith communities that will give out scholarships to their caregivers so they can pay somebody for they can have respite. Supportive education and trainings for those caregivers. So teaching them about self-care, teaching them how to manage home life, things like that. And another example, we have a couple of our churches that do a supply closet for families, because caring for someone is expensive, especially, everybody's circumstances are different. And so these are examples of support. It's not an exhaustive list, but these are examples that some of our faith communities select. Education and awareness. We promote Memory Sunday, which is the second Sunday in June. It is an initiative through one of our partners, Balm and Gilead. And so this is a charge for many of Black churches across the country. Second Sunday in June, they are making some type of awareness within their congregation. It can be as simple as wearing purple, or it can be the faith leader not giving a sermon and having a speaker come in to talk about dementia. Purple Sunday, we have this on here because many of our AME churches, they have adopted the Purple Sunday, and they choose this Sunday. And it's all about awareness. You can do a virtual dementia experience. We have some staff that are trained in this, and they come in and it's simulating what it's like living with dementia. Again, we're trying to enhance that empathy so people can really fully understand and be more sensitive to families. And you can do education on dementia, do education on brain health. We always encourage our faith communities to include youth. Oh, I see a typo. We got to fix that, Mia. But and then the next one is worship. So these are some examples that our faith communities pick. So we talk to them about shortening service length. And so if we're in person, we encourage our faith communities, if there's going to be a service you're going to encourage those living with dementia to come to, please keep it under 75 minutes. And just shoot for that. We understand it can be go over, but just kind of shoot for that, because we teach them about the short attention span. We also encourage our faith communities, they can develop dementia-friendly worship services or snippets of sermons that they can put on their website for families that want to do online. Because even if we look at Facebook, my church is on Facebook, they may be on there for an hour and a half or 60 minutes. That's still too long. So we try to teach our faith communities to think about that person living with dementia and what can we do. So my church, we developed dementia-friendly worship services, which are 6 to 10 minutes in length online. We have another church out of Minnesota. What they did is they just did the snippets of sermons, and they asked each of their ministers to do these sermons. And then they also have songs, short songs, so families can go on and just play, and they can do a repeat if they like. Higher proportion of music, we encourage that. Familiar prayers, using visual aids, having words for the scriptures, having words of some of the hymns and songs that are being sang. And as we work with our churches, this is one of our latest launch. I don't know if we call it a launch party, Mia. I don't know. It's fun. We have fun. And so when our churches partner with us, what's the good of a partnership if your congregation, your members, your community don't know what you're doing? They don't know you're part of this partnership. And so we encourage all of our faith communities to throw a meeting, an event, and we call it where we come out and we let them know that, hey, y'all are partnering with us. This is what they're going to be expecting. This is what's going to be happening. And they can give some feedback. And then also many of our faith communities get more members that were inactive, didn't want to do anything, sign up to be part of this ministry or want to help because they have been impacted in some form or fashion. You'll just be so amazed. We do needs assessments with our churches, and we've noticed a quarter of the individuals that complete these needs assessments at the churches have been impacted by dementia. And it's shocking because many pastors say, oh, I just know 2 people. You just don't know who is there sitting in your pews. You don't. And so I always tell my faith leaders, please build it and they will come. They really will. And we just got to know that we're doing this to help these families. All right. Should I show this video, Mia? Because I know my internet is kind of messed up.
Yeah, it might be a little choppy. I'll send it out and I'll put it in the link.
Okay.
Put it in the chat. I'm sorry.
All right. So within this video, it just speaks more of the results when churches partners with us, what they actually may see. You'll hear from other pastors and things like that, and family caregivers. So as we look at as our future, I'm just going to share with y'all our vision, and y'all can let me know if it doesn't sound right. So I'm practicing with y'all. So Alter, we want it to be recognized as the go-to faith-based, culturally responsive community outreach program. So we want those faith communities that want to do something in this space, that they'll come to us and we can help them and we can guide them. So we predominantly work with African-American faith communities, but we're open to working with we partner with the African-American faith communities, but we're open to partnering with others. So to see what you're doing, I've met with synagogues, just start them off with doing an assessment. So I just wanted to share that, like, we're here to help and serve. Our goal is to promote brain health, spread dementia awareness, and restore trust among historically marginalized communities. And as we're restoring trust, we're also introducing research opportunities, because in order for us to find a cure, we got to have more diverse communities and individuals participate in research. And so I make sure that I provide that education to them. We're hoping to receive funding so we can continue to expand in Georgia and beyond. And over the next 12 months, we are really looking for to partner with community organizations that can assist us on this mission. So how you all can help, you can partner with us. We're always looking for volunteer liaisons, and these are people that help us connect with the churches. So sometimes I'm not sure everybody who's here and what your role is, but we have some people that they're not leaders in the church. They cannot make the decisions, but they want to be part of this initiative some type of way. And so we do have volunteers. Also, if you want more information or you want to say, hey, I think I know somebody that needs to hear more about this, we do an informational session, which is a little bit different than this, every third Thursday at 6 p.m. Eastern time, and you can put the flyer link in the chat as well. And then we offer virtual education sessions. We do them in person, but we do have some virtual ones that are every 3 months. So we just did one in June. And so we'll have one, I believe it's about September. We'll do our next one. So just to let you know, we usually advertise that, and we'll be starting to put our events on our website as well. And we do our best to get the word out to all communities. So of course, me being a nurse researcher, I write papers and manuscripts, right? So my scientists and colleagues can see what's going on and they don't overlook the church. And we also do newsletters that go out to the community, that can go out to your congregation. And we've gone to media outlets where we've been recognized in the news and also in some of our local newspapers, and also nationally. We've partnered with some journalist schools. UC Berkeley came and did a spotlight on us, which was really, really well received. So we're just doing our best to make sure people know about this resource, make sure that our faith leaders know that we are here for them. Now, tomorrow, next year, we're not going nowhere. We are here. And that wraps it up. And if you have any questions, this is some email that you can reach out to me. And I'll also put my email in the chat. So thank you.
Thank you so much. I want to open it up, I guess, at first to see if any of our participants who are watching have any questions about this program. If you don't want to unmute, feel free to type it in the chat. I guess what people are thinking. I just want to say I so appreciate even just the quick overview of some of the initiatives that are offered. I think people sometimes don't know where to start, and even just that little bit before they've even connected with you. I hope that that's inspiring to see. Okay, these are things that are doable. We can do this. Even if you just had a day that was just a hymn, sing, gospel music, sing, and there's such a link between like there's an organization, I guess, that does like memory and music with folks with dementia, and music is such a powerful experience for everyone, but especially folks who are experiencing dementia.
Yes, it is. Very is. All right. Well, this is a quiet group.
Got a quiet group.
I have one question, but I'm gonna just take that as, I was very thorough.
No, it was great. I think it just really speaks to how accessible things could be if, once you kind of prime the pump with the ideas of what's out there. I mean, and it's not just for the people with dementia, but the people who care for them, their health, their well-being. And those who are not maybe familiar with respite care, it's a huge help if you're caring for someone, a loved one with dementia, to have a safe place for them to be, so you can take some time to maybe have some time for yourself, even take a nap, get some errands done, and not have to worry. And the stress on a caregiver is so huge. And so whatever we can do to kind of mitigate any issues that folks are having, I think is really helpful and important. And I think it has sort of a kind of avalanching effect, when we don't step in and we don't support these families, then it becomes a sort of ripple effect throughout the family and the community. All right, we have a question in the chat. Are healthcare providers intentional about diagnosing dementia in the African American population?
So I don't know how quite to answer that. So honestly, we know that there's a lot of the system is the system, right? And we're looking at the Black community. I work with a lot of Black families, and there is discrimination within that. And I've heard there are great doctors, great providers out there that will be on board in diagnosing. Then they have some providers that don't. And that's just the reality of it. And so what we do is we try to empower the families that we work with and caregivers and individuals, and they to interact with the healthcare system. When they do interact with the healthcare system, that they can advocate for the right diagnosis. But I mean, I've had families that say, Dr. Epps, I went to the doctor and they told me it was a scam. I'm too young to have dementia. And that's not the case, because dementia is not for old, it's not just an old folks disease. I have friends that are in their 40s now with this diagnosis. So, is again, just empowering. And then I work with other entities to start educating providers, because they only get a little bit in school. They really do. And if they don't specialize in this, they really don't know what this is. And again, this is across the country, across the world. Providers, some of them are just not good at diagnosing. And I cannot say that they're intentionally not diagnosing the African American community, but I can just share with you some of the families say that they haven't received the diagnosis and the cares they receive if they hear from others, from other race and ethnic groups receiving proper care.
So within the program, is there education around how congregations can help be advocates in the healthcare system for people within their faith community? Maybe come along as a partner to a doctor visit or something like that. Would that be something useful in those scenarios?
Well, we've never went and encouraged one of the faith leaders or any ministry leader to accompany the family like as a advocate for them. We just say that they're part of the care team. But what we do offer to our faith communities, I have a program called Caregiving While Black. So this altar is like a model. And then we feed in this model with several different programs that I create and that my partners may also have. And the course called Caregiving While Black, this is what we encourage our caregivers that are at these churches to take this course. It's an online course. We eventually will be doing one face-to-face, but it talks about how to interact with the healthcare system, how to navigate that system. It addresses the reality of being a Black person in America. So all those things that a lot of people don't want to talk about, we talk about it in this course, and we just hit it head on. And we brought in Black doctors to just tell you, hey, this is what it is. This is what you need to do to make it happen. And so those are the things that we offer to our faith communities, those opportunities to have their parishioners participate in that.
That's tremendous. Yeah, that's really important. I'm glad that you offer that. There's a link in the chat that Mia put there as well. As you've been doing this work with congregations across the country as it's starting to spread, what has most surprised you in terms of what congregations have needed or things that have come up, or are there certain things that have happened in a congregation that have been particularly inspiring and have helped you kind of develop something further that you didn't originally think you would?
Oh, I don't know, Mia, you'll have to. All right, I'm gonna let Mia, you're gonna have to answer that second half.
Right.
I'm gonna do the first one. One of the things we're faced with a lot is when I meet with faith leaders, they're like, oh, well, my congregation is young. They're all college students. So this probably won't be relevant to us. And I'm like, no, it's probably more relevant to you, because if people are getting diagnosed in their 40s with dementia, how old are their kids? They're probably in their 20s. they're probably in college, and these students think they're losing their mind because they're trying to go to college. They're worrying about their parents. They may be doing distant caregiving. And so those are the things that we do. I get faced with a lot, when people say, oh, my congregation is younger. It's not older. So this probably will not impact them or be worth us looking into. So we take some time to explain that. Now, Mia, some inspiration. It's so many, right? Every time we get with a church, we do a program, we hear from our faith leaders the things that they've changed. We have a church in Minnesota that's really, really, they're called Progressive Baptist Church, and they are progressive. They are leading the way. I mean, I can just sit down and just give them the program because they're doing things beyond, they're going over and beyond to support their parishioners, but also the community. But Mia, I don't know if you have some examples
of inspiring churches. Is that what we were talking about? Yeah, I was going to say, I think I'm always just surprised by the commitment that the churches have. And one thing that we find is that they really want to follow our program very closely. So you'll see that sometimes they will, follow, recreate what Dr. Epps has, but it's really when they're able to create things on their own and really customize some of the activities. So we didn't talk about that a lot tonight, but one of the things that we are always inspired by is when someone takes our list or suggested initiatives and they come up with initiatives on their own. So for instance, although we know music and art has a significant impact on people living with dementia and their care partners, it's not in our list, but one of our church partners developed like an art program to, help her loved ones and families within the church. So we find that churches become inspired and creative just by having this conversation and trying to or attempting to meet the needs of their congregants through creative new ways.
That's wonderful. And when the different congregations partner with y'all, is there a way that they get to communicate with one another, the other partner congregations?
Yes. So we do. Oh, Mia, get that queued up to put the summit in there. But we actually do a meet and greet twice a year. And so we do a meet and greet where we bring everyone together online. Our next one is actually August the 19th. And so we bring all our faith communities online. We do a short education on a topic. We introduce a scholarship opportunity that they can apply for. So in August, it's going to be respite. We partner with Respite for All Foundation to give 2 seed grants. So faith communities like $10,000 to $15,000 for them to start the respite within their church. And then we open it up and we have maybe 2 or 3 volunteers from our faith communities to share some exciting things that they're doing. And then Mia and I, we just sit back. And because then they just go on and they start sharing things. They contact each other afterwards because they want to start doing what this church over here is doing. And so we do bring that together. So it's like a family. Mia says that in one of our videos, when you partner with us, it's just not a partnership. It's you're joining a network. You're joining a family of folks that are interested and committed in addressing the disparities around this disease, but also supporting those that are on this journey. And we're having a summit. So one of the things for the churches we don't partner with, we know everybody may not be ready. Everybody's at different levels, and we get that. And we don't want you to miss out. At least being able to take away one thing to apply back. And so we're doing a summit April the 25th through the 27th at House of Hope in Atlanta with Pastor Dewey Smith, Dr. Dewey Smith. And you put the link, yeah, we got the link in there. And so we're holding this summit. And of course, it's going to be praise and worship, but it's going to be edutainment, and it's going to be how-to workshops and research opportunities. So we'll have these sessions over this period of time, and you'll be able to select what you would like to attend. and take back to your congregation.
Thank you. That's tremendous. There's just a lot of opportunities with this. What would you say to a congregation that's kind of on the fence about starting or nervous about getting going? Is there, you have like a message to them?
So Krista, we don't push anybody. We provide the information, and because we know timing is everything, right? And we just tell our faith communities, like I might have mentioned, we are here. So we just encourage you to bring it back to your leadership team, to talk this through. You may want to survey your members to see actually who may be impacted by this in your church. You may want to do that beforehand, and we can help you with doing that. But we are here. And we know when that time is right, the faith communities, they'll reach out to us. And that's how we kind of approach it. Because sometimes we'll speak to the faith community in January and we'll hear from them in October.
No, I really appreciate that. Yeah, because a lot of it's just sort of, cat here, trying to get the information out so people know that you're there. Like I said, I was so delighted to stumble across y'all as I was pulling those resources together, and I was like, this is amazing, and more people need to know about it. And my hope is that through this and then other people who are on here spread the word, so people that know that you're out here and those supports are available. I also appreciated as part of your presentation how you talked about, it's a 2-year program and things take time, and I think the amount of grace that we can give ourselves to not expect that we're going to have this all set up and finished and fully complete in, just like that it's a journey, it's a process, it's, we're learning together. And so I appreciate the emphasis on that as well.
And Krista, I think you said a key thing, we're learning together. So I just want to let you all know we are. And that's what we do tell our churches, like, we are learning together. We're trailblazing. You're coming on, you're trailblazing this with us. Right? Because again, we're still babies at this. I mean, our first church was signed 3 years ago. So we're still in the beginning. Now we're experiencing a lot of growth, but every faith community that comes on, they're willing to learn with us. And we know everything's not perfect. And some things we may be like, that didn't work. Let's scratch that off. We're going to put this right here because we're going to get it. We're going to get it right. But, it's all about learning together.
Yeah, to work with a lot of grace involved in it. And so I think, like, when I met with Mia to start getting this set up, I think at that time we had one North Carolina church, I think, that was participating with y'all. Has that?
We still just have that one, right?
We just have one.
Okay, y'all.
But we do have, so yes, that's a plug. We would love to welcome new North Carolina churches, but we do have a volunteer in that area that we're working with, and she's been amazing. Actually, yesterday she sent us a new contact for a church in North Carolina. So that church, because they're interested in learning more, will attend our informational session. So I just want to, reiterate that if you all are interested or you're, just wanting to learn more, that's a great forum for you to come with questions, and Dr. Epps and I will be happy to answer those. But this is a really great program for health ministries that want to support their aging congregations. So just, it can also fit nicely into some of the programming that many of your churches or churches that are currently offering. So, please consider us. We're here to help for sure, but we definitely want to grow our reach in North Carolina.
I'm again blown away by the opportunities that you offer. I'm going to open up again because I know I've been talking a lot because of the quiet crowd, to see if anyone else had additional questions that they want to pop in the chat, or be bold and unmute themselves. Sometimes during the day we get more comments. I think in the evening people are tired. So I'm going to chalk it up to that. I'll give it a moment.
Hello, everyone. This is TCC News, and I'm your Hello, everyone. Can you hear me?
Yeah, I can hear you.
Okay. I did sign up for this um, Zoom, but I was thinking on another term that, I see the question in the chat about the healthcare providers uh, do not intentionally diagnosed. I am a ordained minister, but I stepped away from leadership in the church at this season because my mom has been with me since November, and she has, she's 94 years old, and she has partial, I would say, I don't know, dementia. She remembers some things, and she forget what she just said, or and so she has a pacemaker, and she's able to get around. She's not bedridden by any manner yet, but she's not that active. Like, we're trying to keep her up and walking and stuff. But you also said something about respite, qualifying for a respite period. And so I'm the primary caregiver, but I have 3 other siblings that help me out from time to time. But I don't know, how do you do that? I'm affiliated with 2 churches. So how do you help someone in the situation like that?
Looking for more respite.
Yeah, at times. Yeah.
Yeah, so
I have a conference coming up myself, and it's about 6 days. My other siblings, they work during the day, um, but then they can care for at night in the evening. But it's kind of hard to make those type of arrangements
so
for just.
me, okay, yeah, I know, I completely understand. So one of the great things is about North Carolina, we actually partner with the Alzheimer's Association for North Carolina. And so when we work with our faith communities, we have a staff member that will be assigned to certain regions to provide those additional resources. So Mia, I'm not sure if you can get Sister or Reverend Claudia's information to find out where she's at, and we can connect her to that particular staff person for the Alzheimer's Association. That's how we provide local resources. We partner with people there, and they're able to give you the resources. They may have scholarships that are available. They may know of some overnight adult, they call them adult day, but overnight respite places. And she may know some other local programs, because we don't have that many churches. We only have that one in North Carolina yet. So we can't refer you to one of our churches that are doing it, because the church that we have now, I believe, is on the outskirts of Charlotte, and respite wasn't one of their activities that they selected.
Okay.
Oh, and look, we have Sister Venitra. There you go. I'm not sure, Reverend Claudia, where are you located? Because
I'm actually located in Holly Springs, North Carolina.
oh, I have no clue.
Okay, so
20
closer to
minutes.
Raleigh.
Yeah,
Closer to Raleigh.
25 minutes from Raleigh, the capital.
Oh, okay, yeah, my dad said, okay. So that's a distance from Charlotte.
Right.
But Sister Venitra, we would love to connect with you. So as we bring in churches in that area, we can refer them to you. But Mia will follow up if you put your email in the chat, or if you want to email Mia, and Mia can link you to the person. And then I don't think they don't have a respite program. I know they have a support program, but they don't have respite.
And
So
another question is that I was interested in knowing, what is the difference between dementia and full-blown Alzheimer's?
So I didn't go into that, but I can quickly touch base on that. And you said a word, you say something about partial dementia. Reverend Claudia, no such.
There's no such thing.
No, you don't have no little bit. You don't have a touch of dementia. Because do you have a little bit diabetes? Do you have a touch of diabetes? Do you have a touch of pregnancy? Do you have a little bit pregnancy?
Okay. All right.
So
That's mainly what I want to know then too.
No. Now there are things that can mimic signs and symptoms of dementia. That's why it's so important to go to a provider and have them run tests and find out what it is, because it could be a urinary tract infection. It could be thyroid issues before we actually say someone has dementia. But dementia is a big umbrella term that says that you have impairment and your cognitive functioning and your behavior abilities that interfere with your daily life. So it's more than when I say behavior, because when people just think it's just your memory, it's also behavior as well that is impaired. Our brain is responsible for so much.
Right. And she
Brain is
said,
impaired.
what?
I say your brain is impaired where you start needing assistance. That's what dementia is. And there's so many types of dementia. So Alzheimer's disease is just one of the most common types of dementia. It's called sags and tangles in your brain, where your neurons cannot communicate with each other. And so that's when people use that word interchangeably with dementia, but it's just one of your most common. But in the Black community, we tend to see vascular dementia first, and then it can progress to Alzheimer's disease or another form. It can be mixed. It's so complicated. And I don't want you all to get, I tell families, I don't want you to get all and go deep down into this, because it's so hard to diagnose the type of dementia you have. So some people just say, oh, they have dementia, because it's very hard. You have Lewy body, you have frontal temporal dementia, and I mentioned mixed dementia. It's so much. But if you have a history of hypertension, diabetes, had strokes in the past, and then you end up having dementia, it's more than likely you're starting off with vascular dementia, where you have a disruption in blood flow to your brain, where we always look at disruption in blood flow to our extremities, to our feet, our ankles. So when you see your ankles and your feet getting dark and swollen, that's occurring in your brain too. And so we want to make people realize that. That's why it's so important for us, if we have any of those chronic heart conditions, that we take care of that.
Oh, okay. That makes it plainer.
I just wanted to share one thing too, since you're in Wake County.
Mhm.
There's the Resources for Seniors is a nonprofit there, and they have some caregiver support services as well. So I put their link in the chat. That might be a place to contact for you since you're in Holly Springs.
Okay, thank you.
I have a question also.
Okay, go ahead.
Okay, I'm also a pastor, and I have a question in regard to resources to get someone to help out as being a caregiver. Say, for instance, on Sunday afternoon, one sister will get my mom up and get her dressed and a meal, but then in the afternoon she needs to leave. So we scrambling trying to find someone to stay with her till the person that comes in at night. And I was wondering if there was a financial resource to pay someone to do that.
Yeah, I think letting us know exactly where you're located, and then we can connect you to those resources that you can then, the local resources, to figure it out. But I will want to tell you, Pastor, this is where we think creative and you think outside the box. And when we partner with our faith communities, there may be things, there's so many people that are retired. My mama is one of them. She loves sitting with people.
Yes.
And
I'm
so
retired.
I'm sorry. Yeah, so it may be
I said I am retired too.
You're retired. Okay, great. So it may be like when we partner with our faith community, it's also finding out who's in our congregation that also may be able to help for those 3 hours. So I just think as we give you these local resources, also look back to your congregation and just see if there are also people, because I mean, it's different ways that we can provide respite. And again, like there's many people out there like my mom, you know, she lives for that. She loves being there for people and helping them out so they can go to work and they can do this and that and she doesn't ask for any compensation.
Okay. So you don't have an office here in North Carolina?
No, if you give us your area where you are, we're going to connect you to our partner, the Alzheimer's Association, who's assigned to your area.
Okay, I am in Chatham County,
Okay. Yeah.
about 30 minutes from Raleigh.
Okay,
Okay.
up there. Yeah.
That's where I used to work at the Chatham County Council on Aging. They're a good place to connect as well.
Yeah.
Yeah, they do. They have
Okay.
care resources. So, yeah, in addition to Dr. Epps and Mia can connect you as well with Alzheimer's Association. The Council on Aging is a great resource to reach out to as well for additional caregiving resources.
I'm
They
familiar with
sometimes have
them.
they sometimes have a wait list, but they do try to get people off it as quickly as possible.
Yes, I am familiar with them. I also work with them too.
Okay, yeah.
Thank you.
Oh, they're wonderful. All right, so I think we're reaching about the end of our time. I want to thank Dr. Epps and Mia for joining us tonight. I think this has been really informative, and I hope that folks will reach out. Just really quickly, I just wanted to share some additional ways that you can work to support the health and wellness journeys of the older adults in your communities is to go onto our health and wholeness website and go to our inclusion plans. You can find it on our focus areas on the healthy aging focus area. You can find it. And it includes some different resources and includes at the very back of the little document, it's a PDF. The last page has dementia-friendly resources and includes Alter and their link on there as well. If you have any questions in general about our Healthy Aging Initiative at the Council of Churches and the PHW program, you can always reach out to me at krista@ncchurches.org. And again, the website for Alter is alterdementia.com. Our website is healthandwholeness.org, and you can follow us on Facebook and YouTube. And I'm going to stop sharing. And just do a quick closing. I think we look in the chat here. Oh, yes. Just some thank yous here. I'm so glad to have y'all with us, and we hope perhaps to get y'all back on with us again in the future. Just before we go, we often at the end of our PHW presentations will do a few moments to just take some deep breaths and rejoice in our day and relax and ease into the spirit of calm and peace. So we'll do 3 deep breaths and I'll count the first one. 1. And thank you so much for joining us, and we hope you have a wonderful evening.